I was even boycotted by my batch, by my seniors, saying कि ये psychotic है, इससे दूर रहो.
So what did depression look like for you during your MBBS phase?
I have high functional depression. Literally 24 hours I have just cried. I have not even slept. My crying spell, I could not stop that crying spell. My voice was visible to everyone in hostel. It was as bad as I could not get out of bed. I could not go and brush my teeth. I stopped eating also. At one point I was asked to have cyproheptadine. So I had developed phonophobia also. Like if anyone opened some sort of door, it would trigger me into an anxiety attack.
How did you start accepting it, and what about the healing?
My passion and my purpose has always been there for me. It was bigger than my depression. Then I had few people whom I loved who are still there in my life. So I continued to fight my battle, and I kept on telling myself that I came here to complete my MBBS degree, so I will do it. I had written that opportunities do not always knock your door. You create your own opportunity.
Behind every rank, there is a story, and today's story is about fighting darkness, healing pain, and rising again. She battled depression since childhood, faced the cultural shock, and still cracked the NEET PG with a 5,103 rank. Welcome, Dr. Riddhi. Your journey is a proof that even in our weakest moments, we all carry a phonics within. So welcome to Salaah Spotlight, and how are you?
Hi sir, good evening. I'm good. I'm glad to be part of Salaah Thoughts.
Okay, so you have been a topper, perfectionist since the time. So when did you first realize something wasn't right? That behind all the marks, that there was a pain?
So it was in 8th class itself when I was said by doctor, like I was having a very high pulse rate. It was usually 100 and 110. Even resting heart rate. So that is when I went to visit my doctors, and then at least 3-4 doctors said that you have generalized anxiety. And that is when me and my parents realized that I'm taking a lot of pressure of being the topper and getting the gold medals and always achieving in academics as well as extra co-curricular. But at that time also, I did not realize that it was taking a toll, because we have always been taught to be a perfectionist and everyone applauds, right? You get all this sort of academic validation. So even when I had these symptoms, I was not ready to accept it. But in NEET UG, when I could not get Maulana Azad and I faced my first failure, that was my first failure in life. That is when I went into depression and I realized, okay, this is bad. This habit of always chasing for the perfect score, always being perfect. So it's a quote in psychology that perfectionism and procrastination are the two sides of the same coin. And perfectionism is actually a very bad habit, because then you crash once you don't achieve or you fail for the first time.
Okay. So do you think being a perfectionist make it harder to accept the small setbacks?
Oh yes, it's like we often see people making fun of people, like 9 out of 100, if someone scored 99, they are still crying. So I was that person, because it is as bad. Even 1 mark, if you are second, you feel sad. And the worst part is you are always competitive. I did not like that. I at that point of time, I thought that competition is necessary, but then that competition is so unhealthy, that jealousy is so unhealthy, they start to come in between friendship also. So no.
So let's talk about your 2019 situation. Matlab, you got 95% in boards, then you got a NEET UG rank of 9,757, and you are not satisfied with that. Like you told, you are missing MMC, it hits you so much hard. So why did that moment break you?
So okay, I will be very clear. So in our coaching, unfortunately, they used to brainwash us a lot that if you are a topper and then only you are anything, you cannot even take drop. So I had that mentality also, that droppers are failures. That is such a bad mentality, but that is what was fed in us. And in school, I had that pressure, not pressure, but yeah, I was told that you are supposed to get 100 out of 100 in all 5 subjects. So you can't imagine, like for me, 95.4 percentile, I cried. I cried a lot on that board marks as well. And then after our results came, 2 days later, we had NEET UG exam. So despite that, I made my mind that I will go and give that paper no matter what, because board's ranks do not matter. And then I went, and in 2019, you might know that it was the first time we had a very bad rank inflation. No one, because that is the first time NTA came into account. So we were told that NTA will prepare a hard paper. So I was so much focused on extra co-curricular, like so much of extra syllabus, that I forgot to focus on the NCRT. And thanks to the rank inflation, we got a rank of 9757. I got a rank of 9757, and I was expecting a rank of 1000, under 1000, because I had Delhi quota, so I always wanted to go into Maulana Azad. So my mom, that heartbreak was so shattering. My mom used to jokingly say to other people to make them realize that it's like a breakup for me. It's like I lost everything, because I used to daydream that I will get into Maulana Azad. And it is the first time I'm publicly accepting that I used to laugh at LHMC also, because I was like, why would I go to the girls' college when I have the capacity to? So I had a lot of arrogance at that point of time. And then life just happened. And I just realized for 1 year, I could not even cross the Safdarjung and AIIMS road. I could not cross it. It was that bad. My mental health was so bad that time, because it was my first failure. I had never seen failure before. Never.
Okay, so many students feel their worth is tied to their dream college. Looking back now, what would you tell that version of yourself?
Oh, for me, even till NEET PG exam, I would say, I kept on saying it to myself that it is not tied, it is not tied. But I had tied my academic validation so much that for me, even this 5000 rank is also something I was sad for a while, that it took time for me to get satisfied. But this is one example which I give to everyone. Anyone who asks, my psychiatrist, he has done his UG and PG, both from private college in Karnataka. No, I'm not even from famous private college, but he's such an amazing psychiatrist. I have been to so many psychiatrists from top institutes, from AIIMS, MAMC, but him, he's just the best. I can't even tell you the amount. It takes me 2 hours to meet him. That is the amount of patient inload he has. So seeing him every day, meeting him for last 6 years, I realized that even I started to internalize that academic worth, like our worth is not tied to academic validation. It should not be. It's your clinical skills, it's your acumen, how much you research, how much you can present yourself. That's what it depends upon.
So you joined a peripheral medical college away from Delhi, new culture, new environment. How tough was that the phase emotionally?
Oh, it was very tough, because like there were very few Delhiites, and that is why I developed CPTSD as well, complex PTSD, because I could never adjust. It's not their fault at all. It's just that I always felt like an outsider over there, because ना दिल्ली वाले लोग अपने में ही रहते हैं, वो दिल्ली वाले ही होता है. So yeah, it was very difficult for me to adjust, because I have been born and brought up in Delhi. So at the age of, I always believed that I could get into Maulana Azad, and then I thought that I would have never have to leave Delhi. So for me, Delhi to go into UP, it was some sort of a regression for me, and a lot of opportunities were not there. I was from DPS Matha Road, so we had so many clubs and so many societies and everything. So for me, it felt like someone just snatched away my freedom, even my freedom of speech. So Delhi people are so what, like we are called rude people everywhere, because that's how we talk, and we are very loud. So it was really very difficult for me. But then, thankfully, I had few seniors and two of my batchmates later on I met. And my dog, my support dog, I found in Jhansi itself. And now she lives with me. She's here with me in Delhi also. She's turning to be 4. So, yeah, that's how I try to cope.
So what did depression look like for you during your MBBS phase? How did you manage studies when your mind wasn't your side?
So first addressing the part how depression looked like, it had phases. I have high functional depression, so I cope by studying. So for a lot of people, it was not visible when I did not want to show. But then when I'm not even kidding. There have been literally 24 hours I have just cried. I have not even slept. My crying spell, I could not stop that crying spell. My voice was visible to everyone in hostel, and sometimes it was very bad. Like my mom had to visit me every month, or I had to come back to Delhi every 15 days. It was as bad as I could not get out of bed. I could not. go and brush my teeth. It could get that bad. I stopped eating also. At one point, I was asked to have cyproheptadine to increase my appetite. And so I had developed phonophobia also. Like if anyone opened some sort of door or any loud noise, it would trigger me into an anxiety attack. So it was really bad. But for me, how I coped was my passion and my purpose has always been there for me. It was bigger than my depression. So whenever I used to feel, I started doing my, thankfully Jhansi has amazing clinical posting, amazing, like amazing patient enrolled. So I started going to super specialty wings in second year itself. So I would go to neurology posting all by myself. I would go to the residents, I would ask them to teach. I would go to the consultants and ask them to teach. I would go to OPDs, seeing patients, seeing them in much more pain, help me elevate my own pain. That is how I coped. And whatever I saw, I used to come back and study. Like for me, study has always been my escape. It is somewhat my superpower, which I call. So I love studying. In first year, I could not even study, but when I started on medications, and this is one thing which I want to say to everyone, that please take medications if they are really helpful. It helped me because for me, I realized when I'm crashing is I had BDC open in front of my eyes and I was crying. I could not read it. That is when I realized that one thing which interested me was studying, and I'm not even able to do that. So I started taking medications, and then my superpower and my way of coping was to feed stray dogs. And because dogs always give you unconditional love, then I used to study and I used to go to postings. And I tried looking for mentors, those who could guide me. And there was this one thing on my door, like I had written it very in. This is for all those who think that they're from peripheral college. I had written that opportunities do not always knock your door. You create your own door. You create your own opportunities. So I had decided that I would seek out help from any resident, junior, senior, anyone who could guide me. So that is what how I try to keep myself safe.
So you were diagnosed with a recurrent depressive disorder and the CPTSD. How did you start accepting it, and what about the healing?
So for me, I have been a psychology student. I was diagnosed with GAD in 8th class itself, and my family was really like my mom was really supportive. I said it to her that now I can't do it, and that is when we both decided to go to psychiatrist. And though my first psychiatrist whom I met, I had a very bad incident. She said it to me that if you are having it in first year, in first month itself, do you think that even that can you become a doctor? Hearing it from a psychiatrist was very painful. It was like already the world is judging you, then she is also judging being a psychiatrist. But and I was even told that just don't try to tell it to anyone, because then you will be stigma, you will have to face a lot of stigma and taboo. But I believe that more I speak about it, more people will resonate and come forward with it. So yeah, I did not have much of an internal shame, and then my mom was also supportive. There was a lot of external shame which was given to me, a lot of labels. I was even boycotted by my batch, by seniors, saying कि ये psychotic ऐसे बोल रहा हूँ, without even knowing my conditions. A lot of rumors were also spread. But then the thing is, I knew my purpose was to become a good doctor, and then I had few people whom I loved who are still there in my life. So I continued to fight my battle, and I kept on telling myself that I came here to complete my MBBS degree, so I will do it.
Okay, so you mentioned lockdown changed everything for you. What exactly shifted inside you then?
Actually, in 2020, it is when I finally met my current psychiatrist with whom I have been for last 6 years, and I met a good therapist. So that is when my journey with therapy started. And in lockdown, I got a lot of time to introspect, to realize where I went wrong, how many negative, like how many wrong thinking patterns I had. I was able to change my mindset. I started writing poems. I started being myself. I started to express myself. I realize the more I try to hide, and the more it is damaging me from inside. So that is when I was, in one word, I was able to introspect. I introspected a lot, and I realized, okay, these are the things which need to be done. So,
So can you quote some favorite lines from your favorite poem which you have written?
oh, it's not. I also read a lot of self-help book. One quote which I want to give to everyone. It's and one story also. There's Dr. Viktor Frankl. He was a psychiatrist in concentration camp Auschwitz. So he has this theory of existential therapy, which believes on how to find meaning when there's no meaning. So this is one quote which is in my bio and which is everywhere. The suffering ceases to be suffering once it finds meaning. So that's my favorite quote.
Okay. So after INI, you got 11K rank in INI. Many would have given up. What kept you going for the NEET PG?
Okay, so the thing is, I had so much of fear of failure. It was look, I realized when after the INI result came, I realized that it's not the academic problem which was the thing. I realized it was my mindset. On INI day, I went with the mindset that I could not fail. I have already failed in NEET UG. I cannot fail again. I have to prove. I have to prove to everyone. I have to get under 1K rank. This is not the mindset which one is supposed to go with. I realized making a mistake because I came across through YouTube video of a senior, Dr. Rapoor sir. So his video made me realize you are going with the wrong mindset. And then I could see my friends who were at the same level got amazing rank because they were confident. They were not thinking of kya result aayega. They just went with the mindset of we will go and execute. We will see the question, we will solve, and whatever. I was so result oriented. I was not supposed to be this result oriented. And the thing is, I have always been a person who cannot give up. I cannot give up. I had even decided that if I don't clear it this time, it's okay. I will take a drop, but I cannot give up. It's not in my blood to give up. So that is why I was like, whatever it is, I will work on self. And jo hoga wo, like, I have this tattoo of Karm Kar, Phal ki Chinta Mat Kar, of Karmanyavadistake. So I realized my duty is to go and work. I will give my 100%, and now whatever happens, happens. That's it.
So finally, NEET PG, you got 5,103 rank. So what was that moment like? Relief, joy, or disbelief?
Oh, okay. So I was in between of therapy session itself, and I saw my result with my therapist and my mom. And like I even asked my therapist that it's okay, I will check, but she stayed with me to check my result. And then I was like, my first action was because I was preparing myself for the worst. I have always been the negative thinking kind of a person, not negative, overthinking. So I was preparing myself for the worst. कि ठीक है, I might have to take a drop because as everyone was saying, कि paper बहुत easy है and everyone will be scoring 150. So I was expecting कि नहीं होगा, इस बार भी नहीं होगा. I was telling in my mind कि emergency medicine DNB I will do, it's okay. But then when I saw the rank, I was happy. I called my seniors. I was happy. I was relieved actually. I realized that now the branch which I want, like not even branch, the first thing in my mind was that I'm back in Delhi because I always wanted to come back to Delhi. So the first thing was I'm back in Delhi. And it was not joy, it was just relief. It was peace, I would say. In one word, it was peace, and it felt like my freedom is back. It's like now I have the power to make whatever decision I want to. So back then, when I got a rank of 9757, it felt like I had no other option. This time, I felt like now I have options. I can choose what I want to do.
Okay, so you even got it tattoo. Why this simple? What does it remind you of now?
Okay, so I have actually 3 tattoos. One is Project Semicolon. It is for everyone dealing with mental health. It was started. Project Semicolon stands for instead of using a full stop, you use a semicolon. Similarly, instead of ending your life, you choose to continue. So it's for everyone fighting with mental health. Second is faith over fear, that I have to have the faith and I don't have to give up at any level. And finally, I have a phoenix. Phoenix is a bird who rises back from its ashes, and I have written still I stand, still I rise. So in these 6 years, there were so many times when I had lost the hope to even live. Like, why should I continue? So these tattoos were actually a reminder to self more than to anyone. All these tattoos were a reminder that I cannot give up. I have to live. I have to fight. And one thing was, I always felt that my journey will one day become survival guide to many other people. So I had to continue.
Okay, so if you could talk to that 2019 version of yourself, what would you tell?
To calm down a bit. It's okay. And to her, I would have said it that you are thinking that the worst has happened, and Nothing can be more worse than that. But that NEET UG paper taught me so many things. My therapist actually said one important thing to me and my mom, that it's good that she faced failure right now. If she would have achieved once again, if she would have been into MAMS and if she would have never seen the failure, and let's assume I would have seen failure in NEET PG, then she said that it would have been very, very difficult because I would have been at that point of time I was still 18. I could have been molded. But she said it to me that if someone faces failure later in life, then it would have been much more tough for me to come back from it. So I'm to that 2019 Riddhi, I would just have said that it's okay, life will work out. You have to trust the process.
Okay, so nice. So for someone watching you feels lost or broken, what's your one message?
Uh, this is uh, this is directly from my heart. When I have battled a lot of suicidal thoughts. Actually, there were days when I was just literally crying, begging God to just end this. But then my dad actually said it to me that you are trying to escape pain, but your soul, if you try to end your life, your soul will not be free. Your soul will not be free from the pain. Because I might say XYZ, so I can say any generic advice, but this is one thing which held me stay back was I am trying to escape pain, and if I try to end my life, maybe I will still not be escaped from the pain. So the thing is to fight here, to fight till the last breath. So yeah, that is when I developed the fighter spirit. So for anyone battling, uh, there are still days when I feel like I can't do it, but then I have to remind. So it's a reminder from me to anyone dealing that I have done it. So many people in past have done it. You will also do it. You will also fight back. You just have to. And if you feel like there's no one, you can't love yourself right now, hold on to, at least you might have your friends. Hold on to one or two people you have and hold on to their love. That's it.
And one small thing that helped you hold on, even on the darkest days.
Oh, it was my dog. So I had to wake up to take my dog out on walk. So it was Buzo. Yeah, I actually developed, I read a lot of self-help books and then I dived into spirituality and then I realized that there is purpose to life even if I'm not finding right now. It make so last 6 years did not make sense, but now it makes sense, like sitting next to you, in front of you. So it makes sense now. It will make sense maybe after years, maybe after 10 years, but it will make sense. So we have to have that hope, tiny bit of hope.
So in the last, I just want to know if you joined Salaah or such a mentor. Okay. So what will be your main goal? How you gonna help students?
Oh, so I'm pretty sure that there are so many people out there, so many good mentors giving a lot of advices to mentees. One thing is, if you be with me, then it's not just your academic thing which will be taken into account. I consider myself as a mental health advocate. So first thing which will be taken care of is you feel you are heard. I will not be dictating you around. You will feel like you are being heard because that's the important thing first. That is the first rapport which should exist.
Okay, so your story isn't about a rank, it's about the resilience. So to every student listening, it's okay to fall, it's okay to heal, and you will rise again just like you. That is Dr. Riddhi. So thank you for being a part of Salaah podcast and for reminding us there is always a hope.